You guys know a true pathogen was capable of causing disease in everybody. Of course, now we're going to understand the term opportunistic pathogen, right? Give me an example of who dies from an opportunistic infection.
Very young and very old.
Good for you. Very young, very old, and very sick. Very young, very old, very sick, and the immunocompromised.
Okay.
Can you name a patient that's immunocompromised?
HIV,
HIV patients and who else?
leukemia patients,
Sorry?
leukemia patients, blood
yes.
cancer patients.
Yes, because they're also put on what's called hematology oncology protocols, and those drugs also weaken the immune system. How about transplant patients? We have to talk about the word virulence. When we talk about organisms and how dangerous and how deadly they are, we use the term virulent. Ebola is extremely virulent. Staph aureus is not so virulent. Next term, exoenzymes and endotoxins. You probably want to know the difference between these two. The exoenzymes are enzymes that actually digest epithelial tissues. You've heard of flesh-eating bacteria.
Mm-hmm.
Because these organisms possess exoenzymes that actually digest epithelial tissues. Versus endotoxins are intracellular toxins that when the organism is ruptured or when the bacteria dies, these toxins will then have an effect typically on the nervous system of the patient. Or they can have other effects. So enzymes digest tissue while endotoxins can cause all kinds of signs and symptoms, like blurred vision, difficulty swallowing, and paralysis, for instance. Like the botulinum toxin, right? We'll discuss that when we get to botulism and the Clostridium and Botox injections. Okay, exotoxins are secreted toxins. Exotoxins and endotoxins are the same with one exception. These are going to spill out into the patient when the bacteria dies. These are secreted from living bacteria.